Morning, Arkansas. You know, severe aortic stenosis is a serious heart valve disease that restricts normal blood flow to the entire body. We have Dr. Irvin Rao here with CHI St. Vincent Heart Clinic, Arkansas, to tell us more about the procedure to correct them. What is the procedure to correct this condition?
Thank you for having me this morning. So aortic valve is a valve that's like an outlet for the heart. It pumps blood out of the heart into different parts of the body. So as people get older, they start depositing calcium and the valve becomes very tight and it doesn't let blood flow well. So traditionally what we did was we did a surgery, open heart surgery to replace the valve, take the old valve out and put a new valve in. But as the technology progressed, now we have a minimally invasive procedure, just like putting in stents. We do a catheter-based technology where we take in a new valve and put it over the old valve and compress the old valve. It's a very minimally invasive procedure.
So how do you determine who's the best candidate for it?
So we have a team of doctors, which includes cardiothoracic surgeons that do open heart surgery, cardiologists that do stents, and we have a multidisciplinary team that includes radiologists, echocardiographers, and we look at all the data, and then if somebody is deemed high risk for open heart surgery or has prohibitive risk, then we take these patients up for this minimally invasive procedure.
And what actually happens during the procedure? You say it's minimally invasive.
Right. So what we do is we introduce a catheter through the artery in the groin and then take it all the way to the heart. And then through that, we take the new valve and just deposit it over the old valve and crush the old valve and put the new valve there.
You crush the old valve?
Yeah.
We'll get into that. It doesn't sound very pleasant, but it's minimally invasive.
Yes.
And just like putting in a stent.
Right. Most people tend to go home the very next day or maybe 2 days later. Traditional surgery is about 4 to 5 days. But again, you have to understand these patients are the people that cannot go through traditional surgery because they're high risk, either due to lung problem or prior strokes or weak hearts. They have to be evaluated by at least 2 surgeons and felt to be deemed high risk for the surgery.
All right. What happens if they don't get the valve replaced at all?
According to the data out there, once people start having symptoms from this, 1 in 2 die at the end of 2 years. Yeah, it's a serious condition. Yeah. Most people come in with either the shortness of breath or dizziness, passing out, or chest pain.
Are there any times when you have to do open heart surgery to replace this valve, or is it completely?
If somebody is very low risk or intermediate risk, the best option would be to do the surgery. Right now, we have only data on high risk. If somebody is high risk for the open heart, then this is the best procedure.
There's always risk with any procedure or surgery. What are the risks of having this?
Yes, there is a small risk of stroke, small risk of having a heart attack, small risk of bleeding through the groin, and small risk of infection. And there's also a small risk of death.
And again, you already mentioned the hospital stay for this is very
Yes.
minimal. I guess it also depends on your recovery.
Yeah, I think that's the biggest advantage. It's minimally invasive. Most patients tend to go the very next day or in 2 days.
All right. And after you have the procedure, does the patient usually have any restrictions in the recovery time?
Usually, they should be able to get back, depending on their quality of life and their mobility prior to the surgery, they should be able to get back in a week's time, back to their routine.
And does this cure the condition, the heart
Yes,
valve?
it is. It completely cures that. And most people have significant relief in symptoms.
Okay. And the blood flows and...
Yes. The new valves are almost, they have the same flow as the native valve.
It's amazing how far medical technology has come.
Yes. We just had, they just released data at the American Cardiology Conference, even on intermediate risk people. So FDA is looking at their data, and then this is a great technology. I mean, it's making great progress.
How many of these procedures do you perform at St. Vincent on a daily? Do you do it on a daily basis?
No, since we have to have the surgeons together and the whole team together to perform this new technology, we do it every other week. But we probably have done close to 80 now.
18?
80.
Oh, 80.
80 procedures, and we have had great results.
What's the success rate?
Oh, I mean, more than 90%.
Yeah.
The success rate is usually having any complication or anything is close to 7 to 8% that's reported in trials, and that's what our data shows too.
Thank you so much for coming
Sure.
on the show.
Thank
Dr.
you.
Rao from
Thank you for having
CHI St. Vincent. Again, their facilities, you can find them on Canis Road. Make an appointment by calling 501-255-6000. That's CHI St. Vincent Heart Clinic, Arkansas at 501-255.